Hi, everybody. It's Patricia Coughlin here on November 6th. A very dark and uncertain time, certainly in the US, but I think um, in most places around the world. Here, the virus is spiking again. We have 100,000 new cases a day. Obviously, the political situation is very uncertain and tumultuous. So, how do we keep ourselves fueled, right? How do we nourish our own mind, body, spirit so we can give our best to our patients? Never mind, of course, all the other people in our lives. So, even though I would much prefer to meet with all of you live and in person, since that's not possible, I've decided to do some webinars so that you can actually see me work. Put all of the practices that we've been learning about into action and to really watch and track the patient's response to intervention. So the first webinar I'm going to be doing is with the San Diego group in California. And actually, that's the second one. That's the first one in the US, and that will be on February 26th. I'm going to have links to both of these webinars down below so that you can get information on them and also register. So actually the first one is this month. It's November 23rd, and I'm going to be doing that with colleagues from Norway. So if you're in Europe, the timing of that webinar is going to be better for you. And if you're in the US, it's going to be better for you to take the one in February. It's actually going to be the same webinar. Again, one for the US, one for Europe. And I'm really going to be talking to you about how to do a dynamic assessment of the patient's current, right now, in the room with you, ego adaptive capacity, how to evaluate the nature and history and severity of their disturbances, both symptomatic and characterological, and again, how to assess their capacity to work with you and to do the kind of deep emotional work required for healing. By assessing the patient's capacity, you're also going to be able to determine relatively early on, within 15-20 minutes, what kind of approach you're going to be taking, whether the person has the capacity to tolerate their intense feelings and exposure to their own unconscious, and you're going to do what we would call a standard vertical unlocking in ISTDP, or whether the patient is also going to require a good deal of defense restructuring or anxiety regulation. Are they going to need a graded approach? So we're assessing their capacity so we can determine as quickly as possible what the optimal approach is going to be. And it is response to intervention, not the patient's history, not the presenting complaints in and of themselves that's going to determine that, and certainly not their history, right? So I'm going to show you how to employ the central dynamic sequence developed by Davenlow in what we call the trial therapy. So this is typically at least a 2 or 3 hour initial evaluation. And I'm going to show you probably 2/3, right, of an initial session, a trial therapy, with a patient who has both multiple symptoms and a lifelong character problem. Luckily, she's in a crisis, and so she's both motivated and her system is already a bit disequilibrated, and so I'm able to intervene in a rapid way in order to facilitate deep change. So you're going to see the whole central dynamic sequence from inquiry to defense restructuring to a breakthrough of feeling in the transference, which triggers an unlocking of the unconscious and a download of memories, dreams, and associations that shed light on the origin of this patient's conflict, allowing us to resolve it at its source, and also to see in no uncertain terms how she has been repeating right? The whole repetition compulsion on that triangle of person, how she has been replaying over and over again the unresolved conflicts from the past. So again, you're going to have a chance to see a patient video where all of the information we've been discussing is actually going to be put into practice. We will have time for questions and answers. My colleagues will be monitoring the chat, and I'll be stopping along the way, both to discuss what I'm doing so you can really track it, but also they'll be looking at, what are the most common questions so we can actually, as much as possible, have a dialogue. So I really hope you will check this out. Again, look below and you're going to see the links both to the November webinar in Europe and the February webinar in the United States. And I hope to see you there. Thanks.